Back home, and it's a growing epidemic that's ranking Australia among the world's fattest nations. Now doctors want to see obesity reclassified as a disease and say more resources are needed to tackle the chronic problem.
An unrecognised disease eating at Australia's health.
We see children as young as 2 years old come into our practice and classified as overweight or obesity.
3 in 5 Australians are overweight or obese, including around 857,000 South Australians.
It's horrendous. It's a shocking problem. It's going to cost our community dearly.
GPs and specialists want to see obesity treated as a disease, just like in the United States.
The population needs to learn that if this is not a moral choice, it's not laziness, it's a real illness.
The AMA need to get their act together. They need, like their counterpart, the AMA in the United States, to come out and say it is a disease and we've got to treat it better.
Treatment options were discussed today by more than 300 medical professionals at the Inova National Obesity Forum in Adelaide.
Our hospitals are becoming overloaded by very obese people with a lot of illness and they're struggling to cope.
GPs say too many patients are falling through gaps in the healthcare system and more needs to be done to help them.
We have no drugs on our PBS system. We have very little bariatric surgery being done in public hospitals. We really need a health system makeover to address this obesity epidemic.
Experts fear that if current trends continue, nearly 80% of Australian adults and 1/3 of children will be overweight or obese by 2025.
The government should set up the system to help GP to manage the obesity in the community.
Jessica Stanley, 9 News.